Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Medicine. The word symbolizes healing, but the wrong medicine or medicine taken incorrectly can cause more harm than good. The good news is medication problems are preventable with the proper help. Our guest today is Dr. Audrey Umbreit. She is a clinical pharmacist who practices medication therapy management at Mayo Clinic Health System. Dr. Umbreit, thanks for joining us today.
Thanks for having me.
Well, let's begin by talking about how prevalent medications are used, especially in our senior population.
Sure. Well, medication use is actually very, very common. One study showed that about 80% of our Minnesota seniors take at least one prescription medication on a regular basis. If we look at the cost of those medications, 1 out of 4 Minnesota seniors spends about $100 or more out of pocket on their prescription medications every month, and that's even after insurance. And if we look at the problems that these medications cause, medication adverse events is one of the leading causes of preventable hospitalizations and emergency room visits. And for every decade that you are over the age of 40, your risk of having one of those adverse drug events increases by 30%.
All right, so what is an adverse drug event?
Sure. An adverse drug event is simply something that is going wrong with your medication. It could be as simple as getting constipation caused from a side effect of your medication, or it could be an accidental overdose that causes your heart to beat irregularly or causes you to lose consciousness.
So it covers the gamut. Could be something extremely serious. It might be something very minor.
Right.
So what can cause those problems with medications, those adverse drug events?
Well, there's many different factors. Of course, there's factors within our own health system and errors that are made by healthcare professionals and prescribers. And we are always trying to help reduce those problems through using technology like electronic prescribing, using computer-assisted decision-making tools to help flag for potential adverse drug events or drug interactions. But surprisingly, one of the biggest contributors is patient misuse of the medications. And in fact, one statistic showed that over 50% of prescriptions are used incorrectly. Some of the more common types of those medication misuses includes taking the incorrect dose of the medication, taking the medication at the wrong time, and then stopping the medication too soon, which can be a particular problem if you're talking about antibiotics and antibiotic resistance when stopping the medication too soon.
50% of prescription medications are used incorrectly. That seems like a really alarming number to me.
It is, and I was startled when I looked at these statistics as well.
So, and you wouldn't think that it would be that high. You know, medications are supposed to help us, but basically 50% of the folks, they're not either getting the right use out of that medication, or it's just it's interacting with something when it shouldn't be, right?
Sure, yep.
So for people taking medications to get better, how can they reduce their risk of having those types of problems?
Well, I think there are 4 very simple, very easy things that everybody can do to help reduce their risk of getting an adverse drug event. The first thing is simply keep an updated medication list. I can't tell you how many times I've met with people and they say, well, don't you know what I'm taking? It's in the computer. Well, I'll let you in on a little secret. That computer is not always up to date. It's really important for you, the patient, to know what you're taking and to keep that record. Review that with your doctor at every clinic visit. The second thing that people can do is simply ask questions. Be informed. If something doesn't seem right, ask about it. The third, and this should be pretty self-evident, but take your medications as directed. Don't try to change the directions without talking with your doctor first. And don't take anything such as an over-the-counter medication or an herbal supplement without talking with your doctor or with your pharmacist first to make sure that it doesn't interact with your other prescription medications. The fourth thing that people can do for people who are taking multiple chronic medications is I recommend getting a medication therapy management visit with a pharmacist at least once a year
Mm-hmm.
to review those medications and make sure there's no problems.
So medication therapy management. I have never heard of that before. Is that a newer concept, and what exactly does it do?
Sure, medication therapy management has been around for a while, but it's still relatively new in healthcare. What it is it's a visit where a patient and a pharmacist sit down together and we go through everything that a person is taking. All the prescription medications, any herbal supplements, any non-prescription medications that a person might be taking. And we evaluate each of those medications in 4 key domains. First, we ask the question, what is the reason that this person is taking this medication? Is it actually treating a medical condition? A lot of times we can find medications and supplements that are not actually really needed. Secondly, we ask the question, is it effective? So is the patient meeting their healthcare goals? Is the drug working like it should be? Third, we ask the question, is this drug safe? So of course we look for things like side effects, drug interactions, and also we look at lab values. Are we checking the labs that we should be checking to make sure that this drug is staying safe over the long term? And then finally we ask the question, is this patient able to take the medication the way that their doctor has prescribed? And if not, what are those barriers? Maybe it's just a matter of forgetting the dose, maybe it's not understanding how to use the inhaler device properly, or maybe there's cost issues that get in the way.
So what's the benefit for the patient to have a medication therapy management visit?
Well, there are many benefits. Time and time again, studies have shown that folks who do these types of visits have a less risk of having an adverse drug event. They're less likely to be admitted to the hospital because of medication problems, less likely to go to the emergency room because of medication problems. Secondly, we're able to help patients save money, not just on their medications, but on their overall healthcare expense as well. And then finally, we can help people meet their healthcare goals, whether that goal is to achieve a certain blood pressure, or maybe that goal is to manage your conditions without medications or with less medications. And I have to tell you, my favorite thing is to help people get off their meds if we can.
Great. So how does somebody go about getting a medication therapy management visit? Do they go see their primary care provider first?
Well, yes, we do provide medication therapy management within the healthcare system. You could also ask your local pharmacist at your pharmacy if they provide the service as well. But interestingly, though, you don't need a referral for the service.
Okay.
You could just call up and say, hey, I want to talk with the pharmacist about my medications.
Fantastic. Well, you talked about keeping an updated medication list, and it's not just a list of the drugs that someone's taking, but much more, right?
You're exactly right. So a complete medication list should include not only the name of the drug or supplement that you're taking, but also how much you take at a time, or the dose, how many times a day you take that dose, and write down what it's for. And then finally, a complete medication list should also include, what allergies you have to medications, as well as any bad reactions you've had to medications in the past.
So can you give me an example of a negative drug interaction that could have been avoided by seeing a pharmacist?
Sure. Well, a very common medication that a lot of people are prescribed, especially after being out of the hospital for, say, like a knee surgery or a hip surgery, is Coumadin. Coumadin is a blood thinner. And I had a patient just last month who was discharged from the hospital after having a knee surgery, and they were started on Coumadin to prevent blood clots. But when I met with them, it turned out that he was also taking Advil to treat pain. He hadn't shared that with his doctor. Unbeknownst to the patient, Advil and Coumadin interact and can increase the risk of causing a bleed. So when I met with that patient, I told the patient to stop the Advil and to use Tylenol instead, which is a safer medication with the Coumadin.
And that goes back to your point about the medication list, that it's not just about the prescription drugs that you're taking, but those over-the-counter drugs, supplements, herbal supplements, those kind of things, all can possibly interact with the prescription meds.
Yeah, a lot of people don't realize that a lot of times those over-the-counter and herbal supplements can interact with your prescription medications.
So Dr. Umbreit, what are some maybe common symptoms of adverse drug effects?
Well, some of the common symptoms if you're having an allergic reaction would include a rash or difficulty breathing, if you're experiencing any of those when you start a new medication, make sure you stop and talk with your doctor or call your pharmacist right away, because that could be signs of a serious allergic reaction. Although allergic reactions to medications really aren't all that common. Some of the more common side effects that people probably don't even realize could be caused by their medications are things like constipation, stomach upset, headache, some dizziness, fatigue. A lot of people write those things off as being normal signs of aging, but sometimes it could actually be a side effect of a medication.
And is that something that you should let your doctor or pharmacist know if you're experiencing those types of side effects?
Definitely, you should talk about it. And even if you've been on a medication for a long time and never have experienced any bad effects to it, what a lot of people don't realize is that even though the medication might be staying the same throughout time, your body is continually changing. And as we age, the way that we react to medications changes.
So a number of medications, they can be really expensive for patients. So how about an example of how medication therapy management helped a patient with the cost of their meds?
Sure. Well, one thing that we can do for patients is to help find less expensive alternatives to expensive brand name medications. For example, I had a patient not too long ago who was taking Vytorin for cholesterol, which is an expensive brand name medication. And when I talked with her and her doctor, we were able to switch her to a less expensive generic cholesterol medication that turned out to work just as well as the Vytorin did. So it saved her a lot of money.
So is that the case for the most part when it comes to medications, brand name versus generic? Do they work the same, or is generic not as good? Or?
Yep, if there's a generic medication available for a brand name drug, it is exactly the same. So, for example, if you're picking up a box of Claritin over the counter and right next to it is loratadine, those two are exactly the same. The way to tell is to look for the active ingredients on the box of the Claritin. So if you look at the active ingredient on the Claritin box, it'll say loratadine.
Another question for you. Expired medication. All medications have an expiration date on them. If you go into your medicine cabinet, you see a medication there that you're having symptoms, again, I don't know what it is, back pain or something.
Sure.
And you see that, but it's past the expiration date. Do not take that?
I would recommend not taking that.
Okay.
I know we don't want to waste medications,
Right.
but the expiration dates are on there not just to protect the drug company, but actually to protect you. In some cases, medications, when they're past their expiration date, they might have decomposed into other ingredients. The medication might not work as well for you, but it could also cause additional harm or cause side effects that you wouldn't otherwise expect.
So it might not be effective, or it might not be safe.
Right.
So what do we do with expired medications? You shouldn't take them because they might not be effective, they might not be safe. So what should you do with your expired medications? Flushing down the toilet is a no-no, right?
It's a no-no. We used to flush things down the toilet, but that actually gets the drugs into the water stream and can harm the environment. And so what you should do is actually hold on to those old expired medications and look for what they call a drug take-back event. A lot of different communities are hosting these now. They're oftentimes at the police station or at the courthouse. If you have questions about what to do with your medications, you can also search online to find some of those take-back sites.
Because, like you said, flushing down the toilet gets potentially into the water stream. You do not throw them away.
Do not throw
they
them
do
away.
not go to the landfill. You get them to a proper receptacle that can hold these type of things, and then they can be handled that way.
Yeah, at those take-back events, I believe a lot of times those medications are incinerated.
So any other words of advice for folks that are currently taking medications?
Well, I think it's always very important for people to be empowered to ask questions. I always tell people, you are the expert on you. So you know if something is going wrong before we're going to know. So make sure you ask, what is this medication that I'm taking? Why am I taking it? How should I take it? Does it interact with my other medications? How will I know if this medication is working? And what should I do if I think something isn't right?
Well, unfortunately, we're all out of time, but I would like to thank our guest today, Dr. Audrey Umbreit, Mayo Clinic Health System pharmacist, for joining us today on Speaking of Health. A great topic. Thank you very much.
Thanks.
Have a great day, everyone, and be healthy.